Week 4 soap note. Subjective. ID LP, date of birth 1/1/1978, 44-year-old Asian Hispanic female, went to the clinic with her husband. LP is a reliable historian. Chief complaint: I feel as on and off light headache, which is very new to me. My blood pressure is around 140 in the past 2 months, and I check it occasionally at home. HPI, LP, 44-year-old Hispanic female, went to the clinic with the chief complaint off and on of light headache, which is associated with fatigue and weakness. She complains if she experiences it on one side, both sides of the head, that lasts for about 15 minutes. She describes it as a throbbing pain in the head. The symptoms are aggravated by activity and relieved by sleep and rest. She feels it mostly at night after work. She rates the headache 5 out of 10. She denies taking any medications. She does not exercise as she feels tired all the time. She loves to eat spicy and fried food. Past medical history, medical problems list is denies any surgical history, hospitalization denies, allergies denies any food, drug, environmental, and latex allergies, medications decide any at this time. Chemical history, non-smoker, drinks alcohol once a week, denies drinking energy drinks, but admits drinking a cup of coffee a day before going to work, denies use of illicit drugs. Immunization status: she's up to date with her vaccinations, including flu shots. She had a complete dose of COVID vaccine 5/13/2021. Her health maintenance: had her last physical exam on 9/15/2021. Family history: father deceased at 73 due to CVA, mother alive 68, hypertension. PGM is deceased at 80 due to HLD. Social history: LP is working as a banker. She earned her college degree in business administration in accounting. She lives with her husband 2 blocks away from the office. She not sexually active since the symptoms started. She always puts a seatbelt when she's in the car. Review of system: constitutionals, reports fatigue, denies fever, chills, and sudden weight changes. Cardiovascular: denies chest tightness, heart palpitation, and edema. Respiratory: denies shortness of breath and wheezing. Neck: denies neck swelling and nodules. Gastrointestinal: denies abdominal pain, nausea, vomiting, and diarrhea. Gastrointestinal: denies decreased urine output. Genitourinary: denies decreased urinary output. Neurological: reports headache, denies syncope, slurred speech, and confusion. Psychiatric: denies depression and sleep disturbances. Objective: vital signs: they are normal, except the blood pressure, which is 150 over 82 millimeters mercury, taken in sitting position, using an automated machine. O2 sats are normal. Height is 5.55. Weight is 122 pounds, and BMI is 20.3. Physical exam: constitutional, well nourished and properly dressed. Cardiovascular: RRR, S1 and S2 sounds are audible, but precordial rub, no precordial rub, no friction edema. Respiratory: chest wall is symmetrical. Lung sounds are clear in all areas. Gastrointestinal is normal active. Bowel sounds: no tenderness noted on abdomen. Skin warm to touch, dry, good. Skin turgor, no skin rashes. Neurological: normal motor symptoms, good coordination of normal gait, good coordination and normal grade. Psychiatric is appropriate mood and effect. Assessment and differential diagnosis: essential hypertension, most likely because patient reports SBP of around 140 in the past 2 months. Hypertension is confirmatory, but blood pressure is consistently more than 130 and or more than 80 per millimeters of mercury. Chronic kidney disease and 18.9 due to high blood pressure rules out because there is no decreased urine output, edema, or pruritus. Objective deep apnea G47.33 due to headache and a high blood pressure ruled out because there is no excessive sleepiness and gasping while sleeping. Financial diagnosis, essential hypertension, diagnostic tests done on 5/25/2022. Lipid panel, chemistry panel is estimated GFR, CBP, LFT, UA, UCG, but the results are pending. The medications are that I would do is start lisinopril 10 milligram PO daily for 3 months. Number 90, no refills. The drug relaxes the blood vessels and lower blood pressure. Educate about the side effects such as dizziness, nausea, vomiting, and cough. Non-medications, educate to engage in exercise like aerobic exercise, put heart stronger and lower blood pressure, make the heart stronger and lower blood pressure. Education provided on to making a journal of home blood pressure check. Educate the relaxation technique like deep breathing exercises. It opens up blood vessels, which in turn lowers blood pressure. Advise DASH diet, vegetables, fruits, and whole grains. Avoid high sodium and saturated diet. Advised using olive oil when cooking. Limit caffeine intake in 2 to 8 ounces cups and brewed coffee a day because coffee raises blood pressure. Then we have the references not needed at this time. Follow-up plan, call patient after a day or to discuss the results of that laboratory. Follow-ups after 3 months are to evaluate if the medications is working and symptoms improved. Advise going to ER when the blood pressure is 180 over 120 or higher and experiences chest pain, shortness of breath, or numbness or fever. Thank you very much.